Welcome to Musculoskeletal Disorders Part 2. This lecture video is going to address club foot. This picture is an excellent example of a congenital club foot. So what happens here is the baby is in utero and it's positional against the wall of the uterine muscle. And this child over a prolonged period of time develops this disorder. It involves the bones, muscles, tendons. It involves the foot, the ankle, and the lower leg. I put a YouTube video up about how we do serial casting. I want you to not only look at how we cast, but look at how severe the defects are. This one is not that bad, but there's a lot of worse ones. And Dr. Ponsetti actually discusses all the abnormalities of the skin fold of the lower leg, ankle, and the foot. So this one is a metatarsus adductus. You see how the toes are pointing towards the middle. And what happens here is we cannot turn this foot manually to manipulate it to stay in its correct position. So we have to do something about it. So here you can see a variety of disorders. We have come a long way in taking care of this. Most of these kids in the past had numerous surgical procedures to correct it. And I'm talking 10, 12, 15 operations to manipulate this foot into place. Now we're having excellent results simply by casting. When you look at the child on the bottom left, you can see how this is a very severe deformity. If a child has a severe deformity and has other congenital anomalies, we may actually leave these feet alone because this child does not have the potential to walk. But when you also look at this child, you see how difficult it might be for us to be able to put diapers on and off. And so we'll have an orthopedic consultation and they'll decide whether or not to do interventions. Here are some diagrams of what is wrong with the club foot. The medical management of this disorder is to do the Ponsetti procedure, and it's by Dr. Ponsetti. So what they do is they stretch out the muscles, tendons, and straighten out the bones, and then they cast it. And you may wonder, well, how are they going to keep it in place? Well, they manipulate it in their hands to see, okay, how much can we manipulate it to get it to move a certain degree? They're going to cast it while the cast is still wet. Then they know where to put their thumbs to apply pressure to make the foot and ankle move slightly. They come back weekly for 3 to 6 months and they continually manipulate this foot until it's in the right position. Once it's in the right position, they want it to stay there. Now the child goes into a brace, and that's what's in this bottom picture. So you can see that they have special shoes, and then there's a bar that connects them, and it keeps the foot in the position that they want it to be. So they're going to wear that for at least 3 months, maybe more, and then during sleep, they will wear it until they're age 3. When the child is out of the cast and into the braces, the parents are going to be taught how to do the passive range of motion so that it continues to stretch those muscles. It's like home physical therapy. They'll be seen by orthopedics for a long time until ortho says this child is completely good to go. There will be some that require surgical management. And what they do is they surgically release the tendon and they insert a pin. They may have to completely reconstruct the foot if there are other anomalies that are present. But when you see this picture on the left and you watch the YouTube video by Dr. Ponsetti, that's what this kid's foot looked like. And after casting, this child was fine. No surgery needed. And you can see that they did casting and then surgery on this child on the left, and look how beautiful those feet look. This ends the video on club foot.